Jervik, and I just wanted to do a quick overview of your integrated care plan, just to help you get full points on this. So obviously it has to be typed, and that's going to be one of the things that helps you get your full points for that first part for organization. Make sure that you turn it in within a week of the time that you take care of the patient. If it's late, the maximum amount of points you can get is 73 points, and any deductions will come off from that 73 points. And really don't want to see somebody start out with that. So looking at that demographic and vital information, you want to make sure that there aren't any blanks, that you have plenty of detail, that you're actually looking through this whole thing on this health history. So if they're NPO, make sure that you're saying what that. If they're diet ordered, make sure you're filling that out, that you're filling out your Morsefall risk score, the Braden scale. And if a hospital that you use is using a different fall risk score, then just be sure to put that in there. Make sure that you're actually calculating that BMI. I would personally recommend leaving the initials blank, just from a HIPAA standpoint, but that's between you and your clinical faculty member. So you're going to keep filling all of this out. Make sure that you have a current set of vital signs and compare that to the admission vital signs. Now, this part here, the IV treatment, new orders, activities, those are the things that literally everything that we do for a patient, we have to have an order for. So obviously you wouldn't have to put the diet in here because you've already covered that above there. But whether the patient is supposed to be out of bed, whether they're supposed to be ambulating with assistance, whether they are allowed to be up ad lib, how often they get their blood sugars done. All of those things you should be filling in this section right here. Now on the labs, you can either fill in the normal values that you have learned, that we learned earlier this semester, or you can write down the ones from the hospital. I don't have a preference on that. Again, you could double check with your clinical faculty member who will be grading it. And then the patient values, make sure that you're trending that data. And then again, let's say that your patient's sodium, so here you'll put the date, down here you'll put the value. Say that their most current sodium level is 148. I know you all know that's hypernatremia. In the interpretation, you can say high sodium, but tell me why. Why do you think that specific patient has high sodium level? Maybe they've been having diarrhea. Maybe we have been diuresing them because they came in with heart failure. And then what would those nursing interventions be? You know, if they came in from diarrhea, we're going to be encouraging PO fluids if they're allowed, or we're going to be monitoring intake and output. So make sure that you're putting both of those parts in there. Diagnostic testing, again, put the date and what the testing is here. What the result is, if there's test preparation. So if they're just going for a chest x-ray and there's no prep, be sure to just write no prep. Patient teaching, perhaps maybe they had a CAT scan and they got IV dye. As hopefully you remember from pharm, if somebody has had CAT scan and IV dye and they're on metformin, when they go home, they shouldn't be taking that metformin for 48 hours from the time that they had that IV dye. So that would be some of the teaching that we would be looking for in that section. If they were having an EGD, that they would be NPO the night before. This part here, when we're looking at the subjective and subjective data, you really have to ask the patients this. So make sure that you're getting in there and asking them those specific questions. You know, you're going to have to ask them, do they do their testicular exams? Do they do their breast self exams? Do they get their mammograms if they're of the appropriate age? Do they get pap smears if they are of the appropriate age? Rumpke, no, sorry, you can hear Rummy scratching back there. Looking on here, most of this activities of daily living, you're going to have to specifically ask, do they have any troubles with that? Nutrition, metabolic, Again, you're going to have to ask, have they had any weight loss or gain? And one of those important questions with that is, was that intentional or unintentional? That makes a big difference, and we'll learn more about that as we go through more of Med-Surg. As far as the elimination, make sure that you're asking them when was the last time their bowels moved so that you can fill that in. Most of this you're going to have to know, but where it has those, do they have any things that they have to do to help with their sleeping? So it has pharmacological and non-pharmacological. You know, for me, that's white noise. Other people may not need anything. My husband likes to have sound going, which is not what works for me, so we have to compromise on that. So you'd have to ask each of us what worked for us. Make sure you're asking about their feelings. Don't assume that based on what they look like matches how they're feeling. That is not always the case. Roles in relationship, again, just because they're elderly doesn't mean that they're not responsible for caring for somebody. They could be responsible for caring for a grandchild, so make sure you're asking those. Developmental task, Erikson's theory, you're just basically going to look at the age, look at Erikson's, and then you'll just say what that is, and then what goes along with that. Sexual reproductive, make sure that you're asking about those. Coping and stress, something that you're not going to know unless you ask. And then what's important about in life for them, what's important in death, and then are there any conflicts with the current health plan? Medications, so I'm just going to give you an example on this one. When I've graded these in the past, a common mistake I see in this is perhaps somebody's on a baby aspirin every day, so that 81 milligrams. Somebody will put in that class action, they'll put that is for pain, and although aspirin can be used for pain, 81 milligrams, that's not what we're giving that patient. So under this client-specific purpose, I need to know, like, why is that person getting that? So maybe they have a heart history, or maybe they've had a history of TIA. So you'll need to put that. When you look at major side effects, again, usually we're looking for 4 or 5 big ones. Sometimes there'll be a little bit more, but don't be writing every single one of those side effects on that. And then, of course, if there's something that you need to monitor before or after, and then client family teaching. And as we've talked about in class, how do we know that medication's worked? So make sure that you are 10 priority medications. So if they're on daily ones, or if they're getting some PRN pretty regularly, those should be the ones that you're putting on there. You can see you have lots of room for that. Now this is the part where people generally struggle the most, is this NANDA list. So I'm going to flip over real quick in here, and if you look, should this go up a tiny bit more? It's not moving for me. There we go. So this NANDA list that's on here, that's actually directly in Canvas. So here it has your nursing diagnosis domain 1. So when you go back to the paperwork here, that functional pattern, you can just kind of consider that domain. So for example, if you have somebody who has a nutritional issue, so maybe they have imbalance in nutrition, less than body requirements. So you have that cute little old person who just isn't able to eat, or maybe they've had a recent stroke and we're losing weight, then that would be the one. So for your functional pattern, you would put that nutrition, and then you would put the imbalanced nutrition, less than body requirements. Now the way if you go back to the form on here that you're going to be filling out, notice that it says completely related to and is evidenced by. So if we were using that example of imbalanced nutrition, less than body requirements, it would be imbalanced nutrition, less than body requirements, as evidenced by, and that would be your, perhaps they've had an unintentional weight loss of 10 pounds. So you're going to say that your related to part is what's causing that. Perhaps they are having swallowing impairment. So it would be, if we go back to our thing here, we have imbalanced nutrition, less than body requirements, related to swallowing impairment, or maybe they're a cancer patient, chemotherapy, and then your as evidenced by would be that weight loss. you have to do 2 full complete problems. And so you have those. Only one of them, as you notice right here, can be a risk factor. So I know a lot of students really like to do that risk for skin integrity problems or risk for electrolyte imbalance. Now, if you can actually pick a actual problem, that is going to be better. There are times that you are going to pick those risk for decreased activity and tolerance. Perhaps they had a broken leg, or they recently had a heart attack. So you're going to pick those and then make sure that those match what you're putting in here. So once you've identified your priority problem, and when you do your priority problem, so if you fill this out and then your next one is actually your priority problem, you can number this 1 and then number this one 2. If you've already filled one out, you don't have to redo it. But make sure that when you're doing priority, you're thinking ABCs, airway, breathing, circulation. Now, intervention, delegation, teaching. So if we had that problem, we'll just go back to that one where I had the imbalanced nutrition, less than body requirements. So if that was our problem that we had here, interventions would be potentially getting dietary consult to try and get them to have foods that they like better. It might be that you are assisting with meals. Maybe they have troubles with eating, and so you're going to assist with meals, that you're going to offer high-calorie snacks between meals, that you're going to offer 5 small meals instead of 3 big meals. We know that's never the answer on an NCLEX question, right? So whatever your interventions are going to be, you're going to fill those out appropriately, and then you're going to give the rationale for why you're doing that. Up here, you're going to have your expected outcomes. So if you had an imbalanced nutrition, less than body requirements, and it's secondary to that swallowing issue and they've had a 10-pound weight loss, make sure with your expected outcome that you're using SMART outcomes. And so what SMART outcomes stand for is SMART is specific. The M stands for measurable. A stands for appropriate. R stands for relevant. And then the T stands for time bound. Sorry, I just clicked off of that accidentally. So let me repeat that one more time. So specific, measurable, achievable, relevant, and time bound. So you would not say that the patient will gain 10 pounds by tomorrow, right? That's not expected. When you think of outcomes, you're not necessarily having to write the outcome for the end of your shift. Think longer term. Think about if you were trying to create a plan to tell a sophomore student how to take care of this patient and what you wanted them to look like in prior to discharge or within a week. So with that time bound, make sure you're picking an appropriate time frame for this intervention. That's one of the big areas that when I grade these that I see a lot of students having troubles with. So again, SMART goals, specific, measurable, achievable, relevant, and time bound. So make sure that they're appropriate for that patient. Now, the evaluation, you're going to put the patient data in relation to outcomes. So if you've had the patient during your shift and you did have something, maybe they had an activity intolerance and your goal was for them to sit up in the chair. And that was your outcome. Patient will sit in the chair for 30 minutes by the end of the shift. You could then evaluate, did they make it? Maybe they only made it 15 minutes. So what revisions would you need to do? So make sure that you're saying what those revisions are. And then should the plan be continued or is the problem resolved? Maybe it's gone away and it's no longer an issue. So this is probably the area where most students struggle with the most. And again, you're going to do this for a second one. Now, on the last problem, here you're going to pick 8 to 10 problems that are identified, and you're going to number them in order of priority, so you can, if you write something out and then you come up with something more important, you can identify the priority later on. Making sure that you're using the correct NANDA terminology. Remember that you have to have the related to, so what's causing the problem, and as evidenced by, so those symptoms that tell you that. Risk problems do not have to have an as evidenced by. And so you're going to fill out 8 to 10 of those problems for this specific patient. Then the last part of this is you're going to write a short paragraph that reflects the discharge plan for this patient. So whether or not that patient, what would you expect you would need to teach them? So you have at least 5 sentences that is going to reflect appropriateness for whatever is going on with that patient. So I hope this helps. I know it's a little bit longer than I was hoping for it to be, but if you have questions, I'm happy to get on a quick Zoom call, answer them between our breaks on Wednesday or after class. So I hope this is helpful. Thanks.